Veye Chest is our deep learning based medical device, and it is used for the detection and analysis of pulmonary nodules on CT chest scans, and it can be used in both screening settings and in routine clinical practice. So standard dose scans for routine practice or low dose scans for for screening.
Screening, right.
Absolutely. So what does it do? So as I said, it detects the pulmonary nodules. It also looks at the composition, so whether they're solid or subsolid, and it quantifies these pulmonary nodules by measuring the diameter and also the volume.
Right.
And importantly, it also compares to prior examinations of the same patient to look at the change over time, so it can see whether a nodule is growing or whether it's resolved, for example.
That's done automatically.
And that's all done automatically.
Right.
So I'll explain a little bit about how it works in the workflow and how it's integrated. So something at Aidence that's very important to us is understanding radiologists' pre-existing workflows and making sure that the medical device that we're developing actually fits into their workflow and it doesn't add work to their already very busy day. So it's fully integrated in packs, and on this slide it shows, I don't know if you can see my cursor, but it shows on the slides that there's the CT scanner where the patient gets the scan. Once it's acquired, the scan is sent to the PACS system. And Veye Chest communicates directly with PACS. It's all done automatically and constantly querying and retrieving new scans that need to be analysed. So once there's a scan in the PACS, it'll be pulled into the Veye Chest software, analysed, as well as prior scans, and the results are then sent directly back into the PACS, so that by the time the radiologist comes to open up that scan to report, the results of Veye Chest are already there for them. This process takes, from the acquisition of the scan, it takes 5 to 10 minutes for the results to be in PACS for the radiologist.
So when I look to this overview, Lizzie, it looks like the Veye Chest engine, the artificial intelligence engine, is really running in the background, and that any radiologist that has access to the PACS system can also make use of our solution. Is that true?
Absolutely, yeah. So we wanted to make sure we developed something that meant we don't limit the use of the software. So the idea is that anybody who's trained in reporting CTs, whether it's radiologists, reporting radiographers, if they have access to be able to report CT scans on PACS, that means they've also got access to Veye Chest. They don't have to log on to a different workstation or have separate passwords, and it makes also, it provides the ability for flexible working. So for, obviously there's also the teleradiology companies where people can work remotely. Also some hospitals have the ability that some of their radiologists can work from home. So if they've got the setup at home to be able to view their PACS and their RIS systems and report scans, they can also report scans with Veye Chest. So I think we're all aware of the hype around AI of the last few years, and of course the AI algorithms themselves are exciting, this really amazing new technology. But I think to get from developing an AI algorithm to actually being really useful in clinical practice, what we've worked on is understanding, well, where does it fit into their workflow? Right. And that's a big priority for us. And yes, it involves developing other bits of maybe less exciting software, but ways that you can fit into the workflow so that we don't disrupt their normal day.